A healthcare giant is telling Lane County medical patients to seek care elsewhere with little notice and no explanation. Thank you for joining us tonight. I'm Matt Templeman.
I'm Renee McCullough. An unknown number of patients with Oregon Medical Group are getting letters saying that their doctor is leaving the practice. It's our top story tonight at 5. KEZI 9 News reporter Jennifer Singh shows us how this decision has caught many patients off guard.
Patients across Eugene and Springfield are now struggling to look for a new primary care provider after many primary care providers with Oregon Medical Group are making the decision to leave. And the medical group also making the decision to leave their patients behind.
No, I'm really conflicted now where I'm at.
Oregon Medical Group was recently acquired by Optum, a subsidiary of United Health Group, the largest healthcare company in the U.S. The company has recently been sending out letters to an unknown number of patients that their doctors are leaving the medical group, and there are not enough physicians within the group to offer a replacement.
I'm 77. My wife is 77. You know, we're close to needing a lot of care, and all of a sudden we're at the curb.
Longtime patient of Oregon Medical Group, Jeffrey Maleka, tells me he and his wife sent a letter back to Optum after they received the notification that they were being let go as patients in March, saying they were disappointed there were no specifics as to who they are supposed to see for care, where their private records are located, and if they are really no longer patients of the medical group.
It's just sloppy. It's just a lot of loose ends, very unprofessional. And it smacks of big business, again, the big gorilla, going for the money, cutting corners, cutting staff, you know.
And he says for him, after roughly 40 years of being a patient of OMG, there's more to miss than just his health care. It's the staff that he's grown to know and love over the years. He says he puts no blame on any of them for this situation.
You know, it was community, and now it's not.
Now the scramble to find a new primary care provider is on, but for many it is not easy. And coming up on KEZI 9 News at 6, I'll show you what more patients need to hear from Oregon Medical Group and what options people have. Reporting in Eugene, Jennifer Singh, KEZI 9 News.
Eugene State Representative Nancy Nathanson says she has heard from numerous constituents getting letters from OMG telling them that they're losing their doctors or being dropped as clients.
Nathanson says she's alerted several agencies of the issue. Now, we met with her in front of Oregon Medical Group's recently closed Southtown Medical Clinic. Nathanson says she's reached out to the Oregon Medical Association, Oregon Medical Board, and the governor's and attorney general's offices, hoping to bring attention to what she calls a crisis unfolding in Lane County. She says on top of doctors leaving OMG and patients being removed as clients, it's a nightmare for folks to find a new doctor.
Some of those patients have been reassigned to other doctors. Many other patients have been set adrift. They have no other doctor yet, and they need help. I'm dismayed that there isn't good information available almost immediately. We need to get the full picture. I know that some of the people who have lost access to their doctor are older people. Some of them are on Medicare, others may have other insurance, but we don't have the exact information yet.
Nathanson says the agencies that she has reached out to are still collecting more information, including how many doctors are leaving OMG and how many patients it's affected. And coming up tonight on KEZI 9 News at 6 o'clock, how she says this issue fits into an alarming overall trend in our state's healthcare system and what can be done to fix it.
Now, we did reach out to Optum for more information about the situation. The only statement they gave us was, as is the case across the healthcare industry, when a physician departs, we notify impacted patients and do our best to transfer their care to other providers. The health and well-being of our patients is our top priority, and we are working with patients to ensure they have access to high-quality care.